ma'am, and welcome to the LDP program. And really, we are very eager to listen to you uh, on your talk on women should have pivotal leadership roles.
Thank you so much, Anaga. And I think it is an honor for me. And I think I'm going to say it today because I'm giving this talk, I think, for the first time in front of Dr. Lalit Verma, sir, who has been my role model, who has been my first teacher in ophthalmology. On day one, when I walked into RP Center, it was his OPD that I walked into. So you can imagine that everything that I do or I try to do, I try to emulate him. So I will share my screen. Is it there?
Yes, ma'am.
So Anaga, when I started getting lectures on these kind of talks, I used to get work-life balance, and I always no balance that can be ever there. It is always a sequential balance. It is always a focused balance, this side and that side. But there is no balance as such in life because to excel, you cannot be a mediocre. And when you balance, you are a mediocre, this side and that side. So for me, what works best is all on, and I mean, either you're there or you're not there. Wherever, I mean, this side or that side doesn't matter. And I don't like, I mean, although Chitra has given me this talk on women leadership roles, but I think ophthalmologist does not have the gender, leader does not have a gender. It is all about your attitude, what you want in life. My thesis guide was a lady, Professor Anita Panda, and I did my MD thesis with her. I think I will give her credit for my very first index publication because at that point in time when you are a PG, you don't know what to do, and when somebody just handholds you and tells you this has to be done, then you just go with that person. My first international conference, which I did as a postgraduate student only, so my first exposure to academics, and she is a role model in that sense. I did not get a senior residency in my alma mater, that is RP Center, so I went to Safdarjung. And I would like to give credit to Dr. KPS Malik for, uh, accepting me there because it was his candidate, internal candidate, who was to get that seat, and he did not, and I got it. And he asked me whether if I would leave if I got a seat in RP Center, and I said I would. And the day I got a seat, 6 months later in RP Center, I shifted. And the magnanimity of this person was that he said, "It is your career, it is your choice, and I'm very happy for you." Professor Dada, who's a very voracious reader, and I learned into getting habit into reading scientific literature, journals, everything from him, slides, video editing. He taught me that you don't even make a side port without the recording button on, and I think that helped me in my clinical skills. Professor Vajpayee, my mentor, my philosopher, my guide, who taught me about surgical skills, writing publications, writing books, innovative techniques. And I think was instrumental in getting me into the international platform because we just followed what he said and we were there, in the various instruction courses, etc. Dr. John Dart, under whom I did my fellowship for 6 months in cornea and external eye disease. And I think everybody who wants to become a leader or so should venture out into the outer world, maybe for a month, for a week, for 10 days, because it's a different experience and it's a different confidence. And like I said, Dr. Lalit Verma, uh, right from my clinical skill development, he would say, have you done your 2 refractions? Have you bought your ophthalmoscope? Because the day you buy your ophthalmoscope, it means you're going to stay in ophthalmology. Otherwise, you're going to leave. So it was out of fear that I bought an ophthalmoscope because he would think that I'm leaving. And every day in the OPD, he would check my 2 refractions. So I'm really, really fortunate to be having him as my first teacher in ophthalmology. I went to UK for my fellowship and I came back. And when I came back in Delhi Ophthalmological Society says, you are uncontested and you have to do the DOS secretary. That was way back in 2007. So he had laid the ground already. I really had to do nothing. Even when I got into AIOS, he was most supportive. And I think I would not have been in any leadership role. And I can say that, on any platform if he was not there. There are breaks in your career, so be it a female or a male, maybe for females it is more, but then that's part of life. You just move on after taking few breaks, and you don't go into that escapist attitude that I'm doing this, so I can't do this. That should not be there. You should be very quick to come back. I think areas of excellence is patient care and surgical skill, your teaching, your research, your leadership role, and you need to have role models. So in patient care, you need to have clinical keen observation for even the minutest of details. And you discuss with your peers, with your seniors, and your teachers are your role models. And of course, you present whatever you document, whatever you write, you present it. I think this is very important that you present. Only then will you get into writing. And this is just to say that I do have a huge number of publications now, but most of them have been written during my earlier phases of my life. Now, uh, it's still there, but not at a speed at which I used to do earlier. And for being a leader in clinical, surgical field or research, you need to have an innovative mind. The moment something comes to you, document it and send it for a publication, even if it is the smallest of the things, because your stamp should come first on it. So I'm just giving you examples of how chemical injury, some 20 patients came, fell into a ditch with sodium hydroxide. We documented. It's nothing, it's only pictures and follow up, and then you just publish. So it doesn't require too much of rocket science. Any new technique, any new thing that comes in, you just do it and publish. So phaco came, we published, refractive surgery came, we published, femtosecond cataract came, we published. And when you go on to your randomized control trials, I mean, you get better and better. Then you go in for your videos where you win awards, and you have to be very persistent. If something gets rejected somewhere, you have to just see that it is on the internet. It is somewhere on the net. It is not lying in your laptop. It's no good. It may not be that good. It may be a mediocre thing, but doesn't matter. It should be on the internet, submitted somewhere. So just to give you an example, one article got rejected 17 times, but I did not give up, and I still saw to it that it published. So then, of course, after you've done a particular amount of research, then you start patenting, like we patented Natasol and Netametrix. Then you start writing review articles, you get invites. Then after writing review articles, you become a part of a collaboration of international people who are going to tell you. So you have to be really smart, you have to be intelligent, you have to be fast in everything, conceiving an idea, executing an idea, and publishing an idea. And then of course you do write books, and you have awards. Now if you see the leadership, if I come to the women leadership, there are hardly any, 17%, whether it is in India or it is abroad. It's not that they are not being made, it is probably they don't want it. So these are just some of the leadership stints that I have. And you have to come out of that barrier of self hesitation and analyze yourself. One is whether you really want to do it or not. If you don't want to do it, if that's not what is making you happy, it is perfectly all right. It doesn't matter. Now, there are some myths about leadership, that knowledge has nothing to do with leaders, and you cannot be managing all around. You have to be a leader. So, leaders have people following them. You cannot be chasing people yourself. And I think true leadership cannot be appointed or assigned. You don't need a chair to be a leader. The power is in a person, not in the chair. And prime example is Dr. S. Natarajan, who on a chair or not a chair is, still powerful. Then anyone can steer the ship, but it takes a leader to chart out the course, and that is what you are supposed to do. Draw out from your past experience, listen, learn, and lead. This is what is the law of addition. And of course you have to be trusting your team. Mistakes, and you have to have credibility, because people will forgive your mistakes, but they will never forgive you if there are lapses in your character and credibility. So come what may, I think you should never lose that. And of course, the respect comes when you lead people. And this is Professor V.K. Dada, my mentor, I had to put. And of course, you have to anticipate doubt, curiosity, identify the team members who are going to come after you. And I think Dr. Lalit Verma has done it, most beautifully, who could identify leaders. And not only me, I think so many others, Rajesh Sinha and others, so many of them that he's nurtured. Then who you are is who you attract. So leader begets leaders. So, if you are a leader, then there are other leaders who follow you. And of course, very important, communication is the key to success. So that should always be there, communication. And you have to shed your insecurity, empower others, and bring about a change. And when I did all this, I was just thinking that it is now time to give it back to the society. So that is when you want to, give it back to the society, that you think of being in a leadership position. And that is when I thought that we should do now, we should try to get into All India Ophthalmic Society, because everywhere I went, there was a name to the publication or to the work, but there was no face to it. For 9 years, I did not attend a single conference. So then I think with the support of everybody who's sitting here, we did make, I just want to show some of the women leaders. This is entire Bhopal. It was in Bhopal, and look at all the women leaders, who are flanking you all over. So you have to enter from the lowest cadre, work towards it, whether it's personal relationship, network, elections, prepare for it. There's nothing wrong with it. If you want it, you prepare for it, you work for it. And of course, after that, I think I would like to also acknowledge all the men leaders who have, supported personally myself to get in here. Without everybody's support, men, women, it would not have been possible. And this is the last slide. When my sister was making, Dr. Mohita Sharma was making a Women Ophthalmic Society, I said, why are you making one? It's not required. She said, probably you have got all the opportunities in life and you are saying so, but there are women who don't get opportunities as you have. And so it is important to give opportunities to everyone. And that is the idea behind it. So I think at that time, it didn't make sense. But now the way this society is doing, I think it does make a lot of sense. And in the end, nothing happens without the support of your family. Your personal front has to be absolutely calm and quiet. Only then can you have professional excellence. And I think my parents were very supportive. My in-laws were very supportive. My family was supportive. Most supportive, of course, has been my husband, who's been, who knows what I want. And he knows that if I don't do the way I do, then I would get more upset. And my daughter, who's now pursuing MD medicine, and again, they have, understood that it is very important in the entire family, not only to chase your dream, but to help to chase each other's dreams. You cannot be throttling dream to be there. So thank you very much for your kind attention. I took my personal anecdotes and I gave this talk because of the fact, because I thought that my personal experience, I would be able to correlate better. And thank
excellent, excellent, Namrata. I
am giving standing ovation.
Thank you.
Standing ovation.
I've taken notes. I've learned new law of magnetism, law of connection, law of empowerment, law of picture. In between one, I forgot what.
Oh, I'll email the topic. I saw that it was exceeding 10 minutes, so that's why I just.
No, but I'm learning law of explosive growth, law of legacy. So I think I would like to have your PPT, Namrata, to learn.
I will.
Thank you.
It was a wonderful
concept.
Congratulations, Namrata.
Thank you.
You are a true leader anyway, so your talk had to be very good. There's no doubt about it. It's just that I missed significant portion of it, but I'll hear from you again.
Good.
That was a.
Thank you, Chitra, for making me a part of this very important LGP session. I think a lot of people are sitting here, Dr. Ankur and all, they already know my story, the way we work. So thank you so much for making me a part of this, really.